Do you suffer from migraines? Migraine is a type of headache characterized by recurrent attacks of throbbing pain on one side of the head. Let's explore what causes migraines and how to manage them. During a migraine attack, nerve fibers in the brain's blood vessels become activated, causing moderate to severe pain. The pain is often accompanied by increased sensitivity to light, noise, and odors. Migraines can last from 4 to 72 hours, making routine physical activities and even simple movements like coughing or sneezing worsen the pain. Migraines often occur in the morning, especially upon waking. Some people experience migraines at predictable times, such as before menstruation or after a stressful week of work. Various factors can increase the risk of migraines, including sudden changes in weather, lack of sleep, strong odors, stress, and hormonal changes. Migraines can leave a person feeling exhausted or weak, but they are usually symptom-free between attacks. If you experience migraines, it's important to identify your triggers and make lifestyle adjustments to manage them effectively. Consult with a healthcare professional for personalized advice. The first step in preventing migraines is to identify and avoid triggers. Keep a diary to track your symptoms and find out what's causing them. Managing stress is crucial for migraine prevention. Try relaxation techniques like meditation, yoga, and mindful breathing to reduce stress levels. Maintaining a regular eating schedule and staying hydrated by drinking plenty of fluids can also help prevent migraines. Getting enough rest is essential for migraine prevention. Make sure to prioritize sleep and create a relaxing bedtime routine. Regular moderate exercise can also contribute to preventing migraines. Find an activity you enjoy and make it a part of your routine. If lifestyle changes don't provide sufficient relief, consult your doctor about preventive medicines. They can recommend suitable options, especially if you experience migraines around your period. In addition to prevention, there are home remedies that can help alleviate migraine symptoms. Let's explore some of them. Creating a dark and quiet environment can provide relief during a migraine attack. Find a calm space to rest and recover. Applying cold compresses to your head or neck can help reduce pain and discomfort during a migraine episode. Hydration is crucial for migraine relief. Drink plenty of fluids to stay hydrated and ease your symptoms. Over-the-counter drugs, caffeine, and certain vitamins like B2 and magnesium can also provide relief from migraines. Consult your doctor before trying any new supplements. Managing your triggers is essential for migraine relief. Avoid strong smells, block out noise, and lower the temperature in your environment.